Hi Camilla, this little video excerpt is about birth breathing or breathing for second stage labour. Now, breathing for first stage labour, we'll cover in another, we've covered before. Breathing for second stage labour is a little bit different. Remember that labour has three parts to it. There's first stage, which is where the cervix is opening, dilating to 10 centimetres. The uterus is working really hard to help the cervix to dilate. And then its function switches during second stage labour to push down to bring this baby into the world. You'll see in the manual that there is a section on labour progression, and that will make sense when you read that, and I'm sure you already understand it. So, first stage labour breathing, we're doing slow controlled breathing, in to 10, out to 20. You can breathe in, imagining that you're filling a balloon, give that balloon a colour, and watch that balloon just float off into the distance. Breathing for second stage labour, the baby's starting to move down into the pelvis, or through the pelvis, because the cervix is fully dilated. So there's certainly a lot more room up here. Your focus of breathing is less in and out from here, but more focusing where your attention is being taken, which is the pressure of a baby's head on the lower bowel, depending on the rotation of the baby. But let's assume your baby, because of all your yoga and your experience and your relaxation techniques, is in the optimal position. So, when we're doing, I don't like to be prescriptive with second stage labour breathing, because I think it's very unique to the situation. It's situational breathing. If you're in a situation where this baby needs to come out, well, sure, I think non-spontaneous bearing down and directed pushing is very useful. But if we work on the assumption that everything's going just fine, when you have a surge, when you feel that surge and the urge to bear down, you can work with that. There's a wonderful book. Actually, it's not so great. It's called Birth Skills by a lady called Juju Sunjan. And she's a physiotherapist, and she works with lots of women in Sydney, most of whom have an epidural. And that's fine. She's working with fear and with adrenaline. We're working with oxytocin and relaxation. However, for second stage breathing, she has this wonderful analogy, and it's about a coffee plunger. And it's a French press. Imagining that your breath is just like the French press. And as you inhale, when you exhale, you don't put too much pressure on that first breath. As you know, with a coffee plunger, you can only very slowly, very gradually press it down as that pressure inside decreases. And it's the same with the pressure of a surge. You can breathe in, imagine that breath flowing down through your body and passing out, showing this baby where to go, or nudging this baby down. It's up to you. You can use the visualization of a blossoming rose at the same time if you like. But certainly the exhalation can be in stages. You know, if you walk up to a French press and you press straight down on it, the coffee will splurt out. And I like to refer to that as popping a blurter. And in my wonderful Australian accent, we don't want you to pop any blurters. We want you to allow the body to unfold and release this baby as you're bearing down. Now, I'm going to show you an example of not so good pushing. I don't believe pushing is bad. Some books, some theories think that pushing is a negative experience. I disagree in its totality. I think that some women get an overwhelming urge to push, and it's wrong of me to tell you that you shouldn't push. There's just good pushing and not so good pushing, and I'll leave it up to you. I think one of the greatest things you can ask your obstetrician is, in your experience, what is the best pushing for second stage labour or the best breathing you've seen? So let me show you an example of not so good pushing. And not so good pushing is pushing when there isn't a surge. So the contraction of the muscle isn't giving that energy, that force, that bearing down effect on the baby to help this baby pass down through the pelvis. And also that the energy that comes with that, you're working with it. Whereas if you're not having a surge, you're wasting energy. During the downtime, when the muscle isn't contracting, that's when you rest and you relax, save energy. The other thing about pushing, or what's implied by pushing, is it sets up a lot of tension. If you think about, come on, I want you to push this, it involves tension in the face, tension in the jaw, tension in the hands, tension in the shoulders. We know that the muscles that cross the jaw correlate to the muscles of the pelvic floor. If you tense your jaw, your pelvic floor tightens, and that's not conducive to birthing a baby. We want a loose pelvic jaw, or pelvic floor, sorry. So, not so good pushing looks like this. Very tense fingers, so you can break fingers if you were clenching someone, holding on to someone. It's not a good thing. Certainly very tense shoulders up through here. It's like a build-up of lactic acid. There's no relaxation. There's no blood flow through the shoulders. The jaw, if I could play back myself, I'm sure my jaw was so tense, and that closes the pelvic floor. But also what it does is it stops you from breathing. We know that all muscles and babies and ourselves need oxygen, fuel, and water. When we set up tension in muscles, we restrict that blood flow. So we're not providing the muscles with oxygen, fuel, and water, and they don't work efficiently. The other thing is by forceful pushing, we can burst blood vessels in our eyes, we can bite the inside of our cheeks or our tongue, and we get exhausted. We also pop blurters. Many women, first time round, who are using obstetric pushing or assistance get hemorrhoids, and I can vouch for that. It's not a pleasant thing. So if the idea is not to pop blurters and to feel relaxed and like you haven't been hit by a bus after that surge, definitely this type of pushing is valuable. And good pushing looks like this. And there you go. There's no stress and no tension. So again, over the next couple of days, anytime you have a bowel movement, this is the perfect opportunity to practice birth breathing. And tell Sven and tell your sister and anyone you know. In fact, definitely work with Isabella on this. This is how I taught Max how to feel safe on the toilet. Many kids feel stressed going to the toilet, and either that's because they're dehydrated, they have constipation and it hurts, or they're scared of falling in. Certainly working with the reflex gives them balance, it gives them safety and security, and when they get that urge to push, just like when you're having a baby, you can breathe that down. So that's birth breathing, or second stage labour breathing. I'm not sure if you found that valuable and I just talked too fast and rabbited on, but certainly while I drink my lovely Spanish wine, you can get some value from that. I may as well teach you controlled slow breathing now while I'm doing this and I've got my confidence. This video has gone for 9 minutes and 24 seconds, so you might be a little bit bored. I'd just like you to close your eyes and take a deep breath in. And now let that breath flow all the way out. That's right. Take another deep breath in. And as you slowly exhale, just imagine that breath flowing all the way down through your body to your baby. You can imagine that breath as a colour. You can imagine those little oxygen molecules, the colour pink. So you can imagine the colour blue. You can imagine the carbon dioxide molecules being released. Wonderful positive oxygen exchange for your baby. You can release very deeply. Notice how comfortable it is just to relax very deeply for a short moment in time. Now you can open your eyes, come back to the room, looking forward to this next slow breathing exercise. Actually, I'm going to do it another one because I don't want the file to be too big.